I'm Yvonne Hamoud, registered social worker and owner of New Moon Counseling, but out of the office, I'm a mom, wife, daughter, sister, and friend. Join me each week as I sit with a special guest to discuss everyday things that impact our mental health. We'll be chatting about everything from mental health and relationships to media and current events, as well as personal experiences and reflections, all in the hopes of normalizing our humanness and helping you see that you're not alone. This is Outside the Therapy Room. Hi everyone, welcome back to Outside the Therapy Room. Today I am joined by Laura Holland. Hi Laura, how are you?
Thank you. I'm good. How are you?
I'm good, thank you.
I'm so excited.
Thank you so much for being here. You are a pelvic health physiotherapist and a podcast host of Birthwell podcast. And I wanted to have you in because we're talking about something that I don't think has been maybe talked about, or we haven't really been taught as women about too much, which is the pelvic floor, and how it can kind of connect to our mental and emotional health. And so would you like to introduce yourself a little bit to our listeners?
Yeah, sounds good. I am Laura. I'm a pelvic floor physiotherapist and a podcast host, as you said. I've been a physio since 2018 and specialized in pelvic health for, I think, going on 5 or 6 years now. And I fell in love with pelvic floor physiotherapy when I was in physio school. I took a women's health elective. So this was an elective course. It wasn't a mandatory course. And that was the first time I ever heard about the pelvic floor.
Yeah.
So I had done 4 years of a science undergrad. I took multiple anatomy courses. In my first year of physio school, we had to redo anatomy and physiology. And at no time had I ever heard about the pelvic floor. So I'm really blown away. And then I actually went to a pelvic physio and didn't have a good experience, and then went to a different pelvic physio and had a good experience. And so that really kind of like ignited my passion for normalizing women's health and bringing something to the healthcare field that I felt like wasn't there when I was in school. So that's kind of how I got started on this journey, and I just absolutely love it. I love talking about pelvic health. I love normalizing these conversations. So I'm very happy to be here today.
Yeah, it's crazy that you went through all your schooling and it was an elective that you learned about pelvic health.
I know.
Like, what does that say?
Exactly, right? Like, so if even as a physio who doesn't specialize in pelvic health, which is totally fine if you don't want to, how would you know how to identify like signs and symptoms where you might need to refer to a pelvic physio, right? I think it's part of the curriculum now.
That's good.
That's mandatory, like, a small section so that everyone just understands. But it was shocking to me. Yeah. And I went to physio school in 2016. So, I mean, 10 years ago, that was when I started. But, like, that doesn't seem like
that long ago. Yeah.
It shouldn't have been archaic knowledge.
Yeah. But, like, honestly, that was my experience, too. Through 2 pregnancies, no one ever said, like, okay, now that you're done, and I had big babies, like they were big. I had to have C-sections for both. And it was never hey, go check your pelvic health or like, go, this is a resource that's available for you to do physiotherapy on this. And it's too bad. It is sad.
Yeah. I'm a C-section mom too.
Yeah.
And my OB, I don't think he knew that I was a pelvic physio, and I never said because I just wanted to be Laura. I didn't want to be, treated any differently or have any kind of like professional things said to me, but he never told me to go to pelvic physio either. And I think that's a really common thing still with C-section moms, even, is that they're not referred, even though you carried a baby for 9 months. And if you carried a big baby, that's a lot of work for your pelvic floor. Yeah. But it's just really a disservice to women. And the conversation is changing, but really I would say only in the last like 5 to 6 years. Yeah, it really is too bad, but this is why you're here. And this is hopefully to spread some of this knowledge for other women and men and everyone really who could benefit from pelvic floor support. But as we do in Outside the Therapy Room, we like to hear a little bit about you outside of your professional space. So would you care to tell us a little bit about who Laura is? So I am a proud IVF and C-section mom to my little girl. Her name is Lily. She's about to turn 1, which is so crazy. And so I feel like the last year of my life, Laura has really been like mom Laura. But in general, if I'm not spending time with my family, I love to travel. We got the opportunity to take our daughter to Europe, which was so special when she was 6 months old. And I love to read. I'm like a big romance girly.
Yeah.
And also a huge Harry Potter fan. So if anyone knows me, they know that I always have like Harry Potter playing on Audible. I actually listen to that. You know how when you're pregnant, they say like, oh, listen to a song all the time and then it will soothe the baby. I listened to Jim Dale on Audible because I was like, when we're both upset at 3 o'clock in the morning, I want this soothing British man to calm us both down. So
I love that.
I'm a huge Harry Potter fan. And I love to work out. I love to do Pilates, love to stay active. So yeah, that's Laura in a nutshell.
Yeah, thank you so much. You're right at home with the romance novels. It's the best, and psychological thrillers. Just I love reading.
Psychological thrillers. I read a lot during COVID, but I don't know what it is now. I just find I need something like really fluffy. I don't know if it's because being a mom takes so much of my energy, or with my patients, like sometimes you're hearing a lot of intense things, like sometimes good intense, sometimes heavy intense. And so, I find the romance novels, I just like, they can shut my brain off. And one of the book series that I like is coming to Amazon in May, so Amazon Prime, so I'm rereading that series right now, so I'm excited.
That is exciting. I feel like I noticed it with movies and shows. We're getting into a whole different topic, but I noticed when I watched movies and shows after becoming a parent that like there were different things I could handle. And so definitely like nice predictable romance is sometimes just what we need.
Totally.
Yeah. Okay. So as we mentioned, like many people don't actually know what pelvic floor does. And so for someone who has no idea what the pelvic floor is, how would you describe it?
So your pelvic floor is a group of muscles that sit inside the bowl of your pelvis. So they attach from your pubic bone, which is the front bone of your pelvis, to your tailbone at the back, and then out to your sits bone. So those are the two bony bumps that you sit on under your bum. And so it's kind of almost like a hammock. That's how I normally describe it to people. So your pelvic floor has to be able to contract and lift, and it has to be able to relax downwards. And your pelvic floor is responsible for 5 main functions. So it plays a role in pelvic organ support. So if you are biologically female, you have typically a bladder, uterus, and a rectum. If you are biologically male, you have just a bladder and a rectum. So your pelvic floor helps to support those pelvic organs from underneath, kind of helps hold them up. It plays a role in bowel and bladder control. So your sphincters are part of your pelvic floor to help keep you continent, which is obviously very important. Your pelvic floor acts as a sump pump, which I think is a function that a lot of people just aren't really aware of, but it helps to work with your like blood flow return. So it helps pump blood back up to your heart. So that can be something that's difficult for people in pregnancy, and why you can get sometimes like swelling in the pelvis and varicose veins and things like that, because your pelvic floor is having to work overtime on a lot of different functions. It plays a role in sexual functions. So your pelvic floor are some of the muscles that help have an orgasm. And it's a really, like, it's my favorite group of muscles, obviously, but they do a lot of functions, and then it helps work with your core as well. So I think one of the biggest misconceptions that people always think about the pelvic floor is that it's just one muscle that goes up and down. And that's kind of what Kegels make us think, because people think about Kegels as just a lift and a lower. So I always like people to know your pelvic floor is a group. It has multiple layers. It has more than one muscle in there. And so that means we need to be specific sometimes with how we train the pelvic floor, not just be able to lift it up and down.
That's so interesting. I didn't even know that it was connected to so many things. I think for a lot of maybe women, we start hearing about pelvic floor because maybe we're jumping on the trampoline with our kiddos and then we pee a little, or like we sneeze and a little pee comes out. And so it is, as you said, kind of like a hammock holding all of these organs in, but it's interesting how that's not just it. It's also impacting our sexual organs and the blood flow into the rest of our body. So that's really cool.
Yeah, it's a little powerhouse.
Yeah, you kind of answered the next question, which was, what does it actually do to the body? But is there anything else that you kind of want to add with that question?
I think the only thing I would like people to know is that your pelvic floor has to be able to relax as much as it has to contract. And I think we'll get into this a little bit later and why that matters when we talk about like the mental and emotional impacts on the pelvic floor. But people typically think about, a lot of times I'll get moms coming in for birth prep saying like, I want to strengthen for birth. I want to strengthen my pelvic floor. And that is important. You do need your muscles to be strong, but you also need your pelvic floor to be flexible. And a lot of people actually present with tight pelvic floors, and so they're not moving properly through their whole range of motion, and that can cause as many symptoms as a weak pelvic floor. So whenever I'm working with my patients, and what I want people to understand is that the pelvic floor needs to be flexible and strong for optimal function.
Yeah, you often look at it and say you need to strengthen. It's not just like the flexibility of it.
Yeah.
What are some common signs that someone's pelvic floor may not be functioning in an optimal level?
So I think the obvious ones that people typically think of is leaking. So for sure, leaking urine or leaking bowel is a big one. I think what a lot of people don't necessarily realize though, like I'm going to break it into categories because I think that will make it a little bit easier. So if we think about bladder health, so symptoms that your pelvic floor could be involved in bladder health, leaking obviously, as I mentioned, but then bladder urgency. So like if you have the urge to go and you have to run to the bathroom, or if you get the urge to go pee all of the time, that can be an indicator that the pelvic floor muscles may be tight and kind of sending mixed signals between your brain and your bladder.
Yeah.
Bladder frequency, so going pee super often. And people will always be like, I drink lots of water, that's why I go to the bathroom all the time. Yeah. But an optimal amount of times to go pee is between 5 and 8 times a day.
Okay.
Even if you're adequately hydrated. So unless you're significantly overhydrated, you still shouldn't have to pee every single hour. So that can actually be a sign of pelvic floor dysfunction. And if you can't empty your bladder. So if you feel like you go pee and then it feels like your bladder is not empty, that would be a big one as well. If we move to like the bowel category, very similar things. So if you're having leaking bowels, obviously that could be an indicator of pelvic floor dysfunction. But same thing with incomplete emptying, constipation, feeling like you really have to push or strain to have a bowel movement. I see a lot of people who have IBS because whether they have diarrhea or constipation, it's a lot of work for your pelvic floor if you're going to the washroom all the time. Same thing with frequent bowel movements. Like if you're going 5 to 6 times a day, that can be an indicator of pelvic floor dysfunction. And then pain, I would say, and sexual function are the other 2 categories. So tailbone pain, pubic bone pain, low back pain. Especially for women who have low back pain plus another symptom, that's almost always an indicator that your pelvic floor is involved. So it's always worth seeing a pelvic physio if you're dealing with back pain plus something else. Hip pain is another big one that I see. And then in terms of sexual function, I see a lot of like vaginismus, which is inability or difficulty having vaginal insertion, pain with intercourse, pain with orgasms, and then also painful periods. So I see a lot of endometriosis, PCOS, so people who are kind of struggling with pain throughout their cycle. And all of those things can be indicators that your pelvic floor is involved. It might not be the main culprit, but there's actually lots of different symptoms that could indicate pelvic floor dysfunction.
Yeah, that's crazy. I had no idea that all of those symptoms could be linked to your pelvic floor, because I think a lot of the times you go to a health specialist and it's like, well, you know, maybe it is something else. Let's get you tested for like bladder stuff or an MRI or an ultrasound, and it's not so much looking at the pelvic floor. So that's really cool to kind of see like how it shows up in our bodies. You kind of talked about this, but is it always about weakness, or can it also be about tension?
Yeah, so I would say in most of the populations that I treat, it's either a combination of weakness and tension or more tension. Okay. Particularly like in premenopausal age women, I don't tend to see a lot of weakness except for maybe during pregnancy and post-birth. But even then, I would say most people tend to have some tension. And the thing is, tension in your pelvic floor can actually cause weakness, because if your muscles are tight and they can't move through their whole range of motion, they can't generate strength, right? Yeah. So a lot of times they do go hand in hand. But I would say most people need to have more tension addressed in their pelvic floor. Like they have more tension problems than they have true weakness on its own problems. Yeah, so it's kind of a combination of both typically. Yeah.
So in my work as a therapist, and also I think throughout the podcast, we've talked about like our nervous system and how our bodies kind of respond to stress or to trauma or to any kind of perceived threat. And so this anxiety and all the emotions that kind of come up impact our body. And when we're talking about tension, and when we're anxious or we're feeling a threat response, our body can tense up a lot. And I guess I'm curious how that can connect to the pelvic floor. So how does chronic stress impact our pelvic floor?
This is such a good question. I'm so glad you asked me.
Yeah.
Because I have this conversation with people all the time. And sometimes I think people think that I'm lying. They're like, how does that work?
You are not lying.
How does it connect? So your pelvic floor is part of your autonomic nervous system, right? Which makes sense because if it is controlling our bowel and bladder function, some of that needs to be under what we call involuntary control. So if you had to think about contracting your sphincters every time you felt the urge to pee, your brain would be overwhelmed, right? So your brain does a lot of those things in the background without you having to think about it. But your autonomic nervous system, in terms of your fight or flight, causes your pelvic floor to contract. Because if you were running away from a tiger, you don't want to have to go pee, right? And so when we're in that state of fight or flight, we typically get a pelvic floor contraction. And as I'm sure you've talked about and talk about with your clients, and I talk about with my clients, a lot of us are in that state of fight or flight all the time. And so then we end up in this state where our pelvic floor is almost perpetually contracted. So we really struggle to relax those pelvic floor muscles. And when you have that continued contraction of the pelvic floor and they're not able to contract and relax, that's when you can start developing pelvic floor symptoms like pain, like leaking, like heaviness. And so a lot of people just in general, I would say, and I think my perception is probably a little bit skewed because I treat women and I tend to see a lot of type A women, and those are the people that tend to be kind of stress holders. And so they're the ones that tend to have symptoms that are coming in with pelvic floor dysfunction and typically presenting with pelvic floor tightness. But I ask every single one of my clients how they would rate their stress level and what they do for stress management. Because we can't get your pelvic floor better just by doing manual release and stretches if you spend the other 90% of your time in a state of fight or flight. So they're very, very highly correlated, and you can't really have a healthy pelvic floor without managing that nervous system, that chronic stress piece. So to answer your question, people who are chronically stressed tend to have tight tension pelvic floors that can, in some cases, cause symptoms.
Yeah. And it is I think when we look at mental health, and this is from, people coming to see me for therapy, there's sometimes this disconnect with the body. And so we talk a lot of there's a lot of psychoeducation that happens in the beginning of sessions because it's like, well, my stomach hurt a lot when I was a kid. Okay, well, that could have been anxiety, right? We're not constantly, some of us aren't educated on how our emotional symptoms can show up in our body. And so then a kiddo complaining about a stomach ache gets treated for a stomach ache, doesn't get treated for what's actually happening, how is he doing emotionally, what are some of the emotional symptoms that are showing up that are making things feel like he has a tummy ache. And so it can be this body mind connection that's happening, and that's exactly what it sounds like you're talking to your clients about.
So one of my favorite books especially for people who've experienced trauma, is The Body Keeps Score. I think it's a fantastic
that's a good one
read, and everyone, especially if you've experienced trauma, should read it. But I think also too, our healthcare system is very siloed when it comes to, in terms of seeing a physician, is very siloed when it comes to thinking about the body. So if you go to your family doctor for something, it's typically one complaint at a time, right? You're not typically allowed to bring forward multiple complaints. And then if you're seeing a specialist, they're only, as you said, so if you have stomach pain, you're being referred to a gastro, and they're just kind of narrowing in on your stomach pain. They're not thinking about it from a more holistic approach. And I think the other thing too is that we still, at least in my practice, and I don't know, you can speak to what you see working on this side of things more, but I still find people feel like there's a stigma associated with mental health. And so in some ways it almost feels easier to address the problem in physio and think of it more as a physical symptom than address the mind, and think of it more as like an emotional symptom that's presenting physically.
Yeah.
So I think we still, as like a society in healthcare, have a way to go where people can make those connections, but also to understand that some of the hard work of getting rid of your symptoms is actually going to come from addressing the mental, emotional health and not just the physical health. So I think it's changing, but
it is changing slowly. But definitely, yes, we definitely hear a lot of that stigma of like, well, I went to my naturopath or my physio or my chiro and they told me that maybe therapy would be helpful. And I'm like, I'm so glad that they said that. So, right? Like sometimes that's not always kind of communicated, but I think those professions can like your profession can see the connection between the mental health and the physical health. So it's great, and hopefully we're starting to break that stigma a little bit more and people can connect it and then get really the support that they need, because doubling up on supports can be more impactful on clients.
Yes, and sometimes I tell people, you know, I'm happy, like I always tell my clients, I will be here as long as you need. But sometimes you are not helping yourself by just addressing the physical piece. And not to say that it's a waste of your time, because we can make some gains, but you're going to hit a ceiling if you don't look at this other piece, right? The other thing I just wanted to mention before we move on is about trauma.
That was my next question.
Oh, perfect.
This is great.
So I see and work with a lot of people who've experienced trauma, and that can come from lots of different ways. It can come from birth trauma, which is probably the most common type of trauma that I see. But I do also see a lot of sexual trauma and childhood trauma. And that tends to show up in ways that people don't always expect. Sometimes it doesn't come up until they're pregnant. I also clinically see a very high correlation of people who've experienced trauma with endometriosis, particularly like trauma that precedes the development of endometriosis. And so sometimes these pain conditions can have a history of trauma in the background. And so again, if you have experienced trauma, your body is in even more of a state of fight or flight and even more protective of the pelvic floor. So you typically have like you've experienced tension for a longer duration of time. And so symptoms can take a long time to resolve, but you have to work through the trauma piece as well. Because if you're constantly having a trigger or feeling in that state of fight or flight, no amount of physical release of the pelvic floor is ever going to make that better. And sometimes I see people who, I always like to think about the pelvis with people who've experienced trauma, it's almost like a black box. So it's like their brain can't connect to their pelvis. They can't really differentiate the front and back of their pelvis. They have sometimes a hard time getting sensations of going pee or having a bowel movement because their brain just doesn't connect well. And so sometimes we have to spend some time, almost like, I call it remapping the pelvis on the brain so that people don't feel scared of that area. But that's a super common response when you have had trauma, particularly sexual trauma, and obviously really hard to force your brain to think about that area. And if you're not processing that trauma in therapy, it's super difficult. And sometimes I tell people, like, we need to pause what we're doing. You have to go and work with someone on like the trauma piece and then come back when you're feeling a little bit, you know, more like that is in hand and you have more tools to manage the trauma response, and then we can continue.
I think our body holds on to so much that our brain is protecting us from. And I know when I've gone to like chiro, my chiropractor kind of joked because they're like, oh, we kind of do similar work. I treat the body, you treat the brain. And it's like, yes, it's all connected. And he shared like having Kleenex all over the place in the office because sometimes you'll adjust somebody and there'll be a strong emotional response. And I'm curious, like, you know, this question just came up, but I'm curious of how you see that, because I'm imagining because of trauma that maybe hasn't been disclosed to you during the intake. If you kind of start working on somebody or at least starting a conversation about something, if there is then that connection between mind and body and it's like, oh, this big thing happens and you have like an emotional response in your office.
all the time.
Yeah.
And I do find that really fascinating.
It
like,
is.
And I feel always when that happens extremely privileged, because that means someone trusts you enough to start opening up that wound, for lack of a better word, right? Yeah. But very rarely is trauma disclosed in a first session. Yeah. Which is fair. Like, you don't really know me yet, you know, like, and so I do find that as that trust starts to build, like that, you know, patient therapist relationship starts to build and people feel more comfortable. Sometimes someone will be fine, we'll just be chit-chatting away, and then you hit a certain area in their pelvis and all of a sudden they're crying, or they're talking about, you know, something super emotional in terms of a family member, or it happens a lot. And sometimes that's when trauma gets disclosed. It's almost like that's where it's being stored in the body. Yeah. And then they feel ready to release it. And it's a super powerful emotional response. And I had a patient once who we did a lot of that work leading up to her birth. She felt like there was a lot of emotional things kind of blocking her baby's ability to come through. And so we would work in different areas of her pelvis and talk about what she was feeling in that area. So it is really, really cool to see someone just go from, you know, like totally fine to all of a sudden you've opened up this channel of emotions. And I think you can't see someone do that and not believe in the mind-body connection, right? Like I've seen it happen enough in my practice that I am 100% believer that our body stores emotions and memories and things that can be a huge contributor to chronic pain and symptoms that are not necessarily being physically driven. Yeah.
Yeah. Well, we kind of went through that question of like, can trauma be stored or reflected in the pelvic floor? And the answer is definitely yes. But do you see any connections between anxiety and pelvic floor tension? Because like I said, our anxiety, some of us can kind of be clenching the whole time and not even realize it, or our shoulders are like all the way up to our ears and we don't really realize it. And so how do you see that connection between anxiety and pelvic floor?
Very common. So as I mentioned, a lot of my clients, I would say, fall into the more type A, you know, always doer, carrying the burden, working moms, sometimes that sandwich generation between, you know, older parents, younger kids, right? And so I would say that a lot of people just feel, a lot of my clients I find deal with anxiety, feel anxious at a baseline, and that tends to manifest physically. So clenched jaw, tight shoulders, clenched glutes, and all of those things can be indicators that someone is clenching their pelvic floor. So there's actually a relationship between the jaw and the pelvic floor. So if you're clenching your jaw, you are contracting your pelvic floor. So for people who are like night grinders of their teeth, wear night guards, and it's important when you're dealing with pelvic health to screen for jaw dysfunction, because a lot of times people are like, yeah, I grind my teeth, and then I see their pelvic floor, I'm like, well, that makes sense. So there's definitely a relationship between anxiety, because when you're in that state of either fight or flight or anxiety where you're constantly kind of like bracing and guarding your body, your pelvic floor is part of that bracing and guarding, and then your body, those muscles are adaptable, right? Like they're very elastic. So the good thing is that you can improve that, but it means if you're someone who's clenching all of the time, your muscles eventually adapt to be in that shortened position. And so they are always clenched, even if you're not feeling anxious. Yeah. Right. And then that's where we can end up having symptoms.
Yeah. That's so interesting. I've been hearing a lot now that I'm like educating myself on pelvic floor about breath work and pelvic floor. So how do these function together?
Yeah, so your diaphragm and your pelvic floor work hand in hand. So in our abdomen, one of the biggest goals of that relationship between the diaphragm and the pelvic floor is to manage pressure. Because we, as I talked about, have our pelvic organs, and our pelvic floor's job is to help support those organs from underneath. What we don't want is to constantly have downwards pressure on those organs. Right. So anatomically, we're designed for our diaphragm and our pelvic floor, which is, I always tell people, kind of like the roof and floor of your trunk, for them to move together up and down. And that's how we help manage our intra-abdominal pressure. So when you take a big inhale, your diaphragm, which is your breathing muscle, and it's kind of like a rainbow in your rib cage, it flattens out because it's moving down to make space for your lungs to breathe. And so when your diaphragm moves down, your pelvic floor actually moves down as well. So it relaxes when you inhale. And then when you breathe out, your diaphragm will contract to help push air out of your lungs, and your pelvic floor is going to lift with your diaphragm. So again, to help kind of manage that internal intra-abdominal pressure. And so a lot of people have a really hard time connecting to their pelvic floor because these are muscle groups that people just don't think about. They haven't been taught. And so their proprioception, which is your brain's awareness of where your body is in space, is generally very poor for most people. And so diaphragmatic breathing and breath work is a really good way to tap into the pelvic floor movement, because you know if you're moving your diaphragm, you are moving your pelvic floor even if you can't feel it. Right. So it's a way to start training that ability of the pelvic floor to relax and contract without necessarily having to think about physically moving those muscles. So for people who have trauma or stress or just generally really struggle to connect with their pelvic floor, it's a really good place to start. And then of course the other thing, as you know, is breath work taps into the nervous system. So when you are activating that parasympathetic nervous system and you're moving out of that fight or flight response with breath work, the pelvic floor is actually able to relax, right? Because as I mentioned previously, your pelvic floor is going to contract in a fight or flight response. So using breath work to down regulate your nervous system puts you in a position where you are then able to use your pelvic floor more effectively, because it can then actually lift and lower when it's not in that state of clenched contraction. So breath work, I would say, serves two purposes in tapping into the pelvic floor.
And breath work from the mental health perspective just really helps us kind of connect back into our body. And when we kind of apply like the, tummy expand and then the tummy kind of going back in, or like the balloon breath, like we say with kiddos, it also adds like a mindfulness kind of place where now we're visually seeing our tummy expand with our breath and our tummy kind of deflate with our exhale. And so it is, again, just bringing like the mind body connection. It is kind of doing all of that without us even maybe realizing that it's supporting our pelvic floor.
My favorite one to do actually is box breathing.
I love box breathing.
So 4-second inhale, 4-second hold, 4-second exhale, 4-second hold. So I find, number one, it gives the brain enough of something to think about. So it kind of takes you out of your like pelvis and maybe where you're having a hard time and into a different area of your body. But then number two, it also is very rhythmical. And so, but it's not just an inhale and an exhale. So it just really helps like relax the body. Like when I am working with trauma clients or vaginismus clients, especially when we do things like dilators, I always have them do box breathing. And I have way more success with being able to make dilators more comfortable and easier to use when we do box breathing than any other type of breathing.
That one's a really good one. And you're right, it kind of does have like this routine to it mentally as well. So you kind of already answered the question about working with clients who maybe didn't realize that their pelvic symptoms were stress related. So how does that kind of look like in terms of what you witness, your client's experience of learning that their pelvic symptoms are actually maybe more related to mental health as well?
I think sometimes people, it goes one of two ways, I would say. Either people kind of had an inkling and they needed someone to validate that for them. Or they are like, no, this is, they're like in denial about their stress levels. They're like, I don't feel stressed. It's always fascinating to me because, as I said, I ask people to rate their stress. And I'm like, oh, how would you rate your stress on a scale of, 0 to 10? And most people are like 7. And then they'll tell me they don't feel stressed. And I'm like, your stress is a 7 out of 10.
Yeah,
like,
that's high.
That's high. What do you mean you don't feel stressed? Like, I think some people just can't, they're so used to functioning at that level all the time that they can't understand like how much that is impacting them. So I think for some people, it takes a little bit to get that buy-in, if I can use that word, of understanding that so some people, it either clicks for them right away and they're like, oh yeah, I thought that might have been correlated. And other people are kind of like, no, this is a physical problem. And it takes a few sessions to kind of get them to understand and see that relationship. And I will tell people, like, notice if I think there's a big stress component. And I'm like, notice when you're in a meeting, when that annoying coworker is talking, do you feel like you have symptoms? Does your tailbone start hurting? Are you clenching your jaw? Because you are clenching your pelvic floor. And when you start drawing attention to how those physical symptoms are correlated to what might be happening in terms of a stress response, it slowly starts to kind of click for them, and they do eventually understand. But I think so many people are just used to functioning at a like baseline level of stress that is quite high, that they don't always recognize what it feels like to be not stressed, and therefore what it would feel like for their body to not be in that state of stress.
Right. It's just kind of normalized for them that this is their level. And so to be like, oh, wait, no, I'm actually not stressed at all. It can be a little bit of denial, but also just it's the lack of awareness because they've been in that state for such a long, such a long period of time.
Exactly.
As you know, I'm sure like pain, chronic pain, anything like that really impacts our mental health. It can, again, bring us into this fight or flight, but we're also experiencing grief. Maybe we're feeling grief or disappointment towards our own body for feeling this way. And so it can just be a lot that kind of comes up. But how do you see pain affect someone's mental health in your line of work?
I think it's pretty hard to have one without the other.
Yeah.
And as you said, pain, like being in pain all the time is quite exhausting.
Yeah.
It's really hard to be motivated to get up and function when you know everything is going to hurt. So I see a very significant impact in people who deal with chronic pain. And I would say the chronic pain that I see the most is period pain and endometriosis. Yeah. Right. And so most of my clients who have endometriosis and pelvic pain, they're dealing with those symptoms probably 3 out of 4 weeks of the month. Typically. Yeah. The pain may fluctuate over the course of their cycle, and it might be different as they go through different points in their cycle, but it can be extremely debilitating. Some people can't work. Some people have to have, a lot of things to be able to make it through the day. Advil, heat pads, supplements. They have a lot of coping strategies. And so it is something that is definitely a very significant impact on the pelvic health and the pelvic floor, because when you're in pain like that, you're stressed, you're tired, you're anxious, the pain is coming, particularly for period pain because it's so cyclical. Yeah. Like, okay, at this day of the month, I know I'm just going to feel crappy. And that really sucks. Like, it really can wear you down. So I definitely see a huge, huge amount of anxiety, of stress, of mental health things going hand in hand with chronic pain.
Not to mention, like, with those two diagnoses, endometriosis, PCOS, like all of those, it can also add a level of frustration and anger. Yes. Because they have to advocate for themselves so much just to get a diagnosis and get any kind of support. And so that also is going to kind of impact the chronic pain and the mental health and everything. It's just, it's a mess.
The other thing too, just to add, is that with those types of things, is that hormones, female hormones, really do impact your emotional state. Yes. Right? Like when you're between ovulation, so midway through your cycle and your period, in your luteal phase, you get kind of that natural hormone drop, and most people just generally feel down during that time, even if they don't have endometriosis or PCOS. So not only are you dealing with chronic pain and the stress of trying to get diagnosed or managing your symptoms, but then you're also having to fight uphill against these hormone changes that are a normal part of a female cycle, but they don't make you feel good. So it's an added layer, which can be tricky.
That is, it is tricky. We've talked a lot about kind of women's health, but I am curious too, for those who have male organs, how does pelvic floor actually support them?
So your pelvic floor, as I mentioned at the beginning, supports the pelvic organs, plays a role in bowel and bladder function, plays a role in sexual function, some pump function, and that's the same for everyone. It's the same for children, it's the same for men, it's the same for women. So the way that can show up for men is I see a lot of like leaking. Like, I would say the biggest one is prostate removal. So men who've had prostate cancer, because the way that anatomically the male bladder works is that one of your sphincters is in your prostate, and then the pelvic floor is the second sphincter. And so typically men, even more so than women, it's actually one of the places of healthcare where I think men are actually discriminated against more than women in terms of talking about pelvic health. Which is rare in healthcare, but unfortunately it's very difficult for men to to talk about that area of their body, because there's so much masculinity and
shame
like layered into it, right? So most men tend to have no idea that they have a pelvic floor. It's typically not very strong. So after men have their prostate removed, they tend to deal with a lot of leaking issues because their pelvic floor is weak, and that automatic sphincter that was helping them while their prostate was there is now gone. So I would say that's probably the biggest reason that men tend to seek pelvic floor physiotherapy. But then also pain, right? Men can have tailbone pain, they can have painful ejaculations, they can have pain in their pelvis, they can have low back or hip pain. So I would say that symptom cluster tends to affect younger men. The prostate removal, obviously, prostate cancer tends to be in men who are a little bit older. And then, of course, they can have bowel dysfunction as well, right? Constipation, hemorrhoids, straining, and that could be pelvic floor dysfunction related. So they could seek care for something like that. And sexual dysfunction, right? Erectile dysfunction can partially be related to the pelvic floor because, as I mentioned, the pelvic floor plays a role in sexual function for both men and for women. So those are some areas that men would be needing to seek pelvic care. It's also an emerging area for kiddos. So pediatric pelvic physio is starting to become a little bit of a thing with late bedwetting, later accidents. I think there's a lot of pressure on parents because children need to be potty trained by the time they go to kindergarten. Right. And so some kids are late bedwetters, and what you'll hear from doctors, and I'm not a pediatric physio, and I'm also not a pelvic physio that treats men, but just knowing from kind of like in my experience. But a lot of doctors will say it's a personality problem. Like they don't want to go to the bathroom. They're not waking up to go pee. And I actually used to work in a clinic with a fantastic pediatric pelvic physio, and she would always say, like, no kid wants to pee their pants. This isn't something that they actively choose. There's something going on for them that's probably not behavioral. A lot of times it's actually constipation. So kiddos' bodies are so tiny that if they're not having good bowel movements and they're not fully emptying, that rectum is going to press on their bladder, and it makes it hard for them to hold their bladder for long periods of time, like overnight or at school. And so that's actually something that does need to be addressed. And sometimes when kiddos are like 3 or 4, they start gaining that independence of going to the bathroom. So parents aren't always seeing. So kids are saying they're pooping, but it might not be, they don't know what a full empty looks like, or the texture of the poop and things like that, right? So if you have a kiddo that's dealing with late bedwetting or peeing their pants, like having accidents, and they're, you're trying to potty train them, for sure seeking pediatric pelvic physio can be super important. And then the other population where it's quite important is for folks that are transitioning genders, particularly folks that are going from male to female and having that reconstructive genital surgery. It's really important to do dilator work to make sure that you are having good surgical rehab after that transition. And so that's another area. Again, I don't work with that population specifically, but that's another area that pelvic physio is emerging and really, really important, but not talked about very often.
Yeah, I think all three of those, right, that you mentioned, I think it's the focus of pelvic floor care is so focused on women right now, but it is really great to hear that there's so many other benefits for so many other people, including kiddos. Yeah, that's just really cool to hear. And again, not something that you would normally know or learn about from another health professional who would recommend the service, right? So that's great. You touched on something that's really important in terms of men maybe feeling a lot of shame in terms of their, around this area of the body, but also for a lot of folks who are experiencing incontinence, pain, in intimacy, difficulty with postpartum, there can be a lot of shame to talk about these things. And so people kind of keep it silent or disconnect from it. What are some small things people can start doing to support their pelvic floor health?
So I always tell people that bowels, in my opinion, is the cornerstone of good pelvic health. So if you're not pooping every day and it's not easy for you to poop, that is 100% going to impact your pelvic floor. So get a squatty potty. It's a little stool that goes in your bathroom that will help make bowel movements easier. Make sure your, water, fiber, doing all those things to try to get bowels easier. So that's one thing I tell people.
Yeah.
Another thing is not pushing to go pee. So I find a lot of particularly women, particularly who are stressed, go into the bathroom, push to go pee, and then leave.
Yeah.
So your bladder should actually contract on its own to empty. You shouldn't have to force urine to come out. And if you are doing that, what you can actually do is cause tension in the pelvic floor, because you're using your pelvic floor to push the urine out, which is not its job. And so over time, that can cause pelvic floor symptoms. Just staying, physically active, and it doesn't have to be anything crazy, but going for walks, things like that, and making sure that you understand your pelvic health. So incorporating some breath work, understanding how your pelvic floor works, like we've talked about earlier in the podcast. So that way you can identify I think knowledge is power, right? So you can identify if you need to seek care. And I think the other thing that's really important is understanding the difference between what is common and what is normal. So just because something is common doesn't mean it's normal. And I think this is a trap that a lot of particularly women fall into, because and in the pregnancy and postpartum period, women will be like, oh, you had kids, that's why you leak. And it's like, yes, that is probably why, but it doesn't mean you have to live with that for the rest of your life. There's a lot of kind of normalizing of those things. And I think that makes people not realize that they can do something about it. But then because of that shame piece, like you mentioned, people feel too embarrassed to come forward and say, this is happening to me. Yeah. And it's actually very interesting to me, because one of the biggest reasons that girls drop out of sports when they're teenagers is because of leaking. So you don't have to have kids to have leaking, because as I mentioned, a tight pelvic floor can cause leaking. So a lot of female athletes, dancers, soccer players are two populations that I see quite common, but in general, any female athlete can have a tight pelvic floor. Weightlifters is another big one. Yeah. And so the girls are embarrassed, and so they drop out of sport. So I think also, making the conversation more normal with coaches, with parents, particularly dads and moms, right, of teenage girls, just making the conversation more normal so that people don't have to feel shame associated with these symptoms. Yeah. And that's not necessarily something that someone can do maybe as an individual to support their pelvic health, but if you are a parent of a daughter, making sure that you are both comfortable having the conversation about periods, about what's normal for leaking, what's normal for bowel function. So to summarize, making sure your bowel and bladder function is good. Squatty potty, don't pushing to pee, those are easy things that you can do. But also then on like the societal side, understanding what's normal versus what's common or expected. Yeah. And being able to talk to friends or family about it if they're bringing forward symptoms in a very neutral way that doesn't incite that shame. Right? Yeah. Because a lot of times if people are saying they're experiencing something, it probably took them a lot of courage to be able to say that. Yeah. And you want to be able to kind of help facilitate that conversation in a very neutral way.
Yeah, like the thing I teach my kids too is like kindness, even just like opening up the conversation or any kind of negative response to somebody sharing something. Being kind and just sitting with it, or, asking more questions or whatever it is, like that's going to remove that person's shame around it, which can actually be really beneficial that we don't always see, but that person might actually go and seek out support. Yeah. They might contact you and be like, hey, I'm peeing while I'm running and kicking the ball really hard or whatever it could be. So that is really important, all of those things that you had mentioned. You've said a couple of things through our work here, or through our conversation here. You've said dilating, and you've said kind of like when they're working with you, touching the pelvic floor in certain ways can kind of bring up emotion. So what does pelvic floor therapy actually look like?
Yeah, that's a good question. So I would say it's super different for every individual. It really depends what you are coming in for. So in the kind of like touching the pelvic floor, what I was talking about was actually pelvic floor muscle release. So that's a big part of what I do, if people feel comfortable with it, of course, and if it's clinically indicated. But when the pelvic floor is tight, we can actually manually release the pelvic floor. And that is something that that is done internally for women vaginally, or it can be done rectally. Typically vaginally though. For men, that would be a rectal exam or a rectal release. That's actually something I should mention about men, because I think sometimes they're like, what? You're gonna assess what, where? So if you're a man listening to this, just so you know, an internal pelvic floor assessment is done via the rectum. So physiotherapists who specialize in pelvic health have gone through additional training to be rostered in Ontario. I'm speaking specifically to be rostered to perform internal exams. So that's not something that every healthcare provider is allowed to do. Like osteopaths, not allowed to do internal exams. Massage therapists, not allowed to do internal exams. They can assess the pelvis in other ways, but not internally. So physiotherapists who specialize in pelvic health have had to take courses and have an exam to know that they are certified to assess and treat the pelvic floor internally. So sometimes what we do is we do internal muscle release to help release some of that tension in the pelvic floor. And that's where sometimes we see when those areas of tension are released with that manual muscle work that I do in the clinic, sometimes we see those emotional responses. In terms of dilators, that is something that is typically used for people who experience pain with penetration. So difficulty having penetrative intercourse, pap tests, transvaginal ultrasounds, inserting tampons or menstrual cups. Typically that goes hand in hand with a condition that we call vaginismus, which is a pelvic floor muscle response to insertion vaginally. So basically the pelvic floor closes down. It almost forms like a wall, so you can't actually have penetration, which is very painful. But dilators can also be used for people who struggle with painful intercourse. And that is basically teaching your body, so your brain and your pelvic floor, to be able to tolerate insertion. So we start with a very small size and work our way up from there. So that would be what like a specific treatment session would look like for someone who's dealing with that specific condition. Not everyone who comes to pelvic physio would get dilators, but in general, I would say if you're coming for a session, there's always going to be education. So we're always talking about how your pelvic floor functions. We look at your bowel and bladder, period health. Sometimes there's education about things that you can do at home. And then sometimes we do manual work, so releasing the pelvic floor muscles. But I always tell my clients when they come in for their first session, we're looking everywhere between the shoulders and the knees. So sometimes we do manual physiotherapy release work on the low back, on the glutes. Sometimes I do hip mobility. So like if you would go to a regular physio and they would do a treatment session, pelvic physio is the same, and the treatment session is very tailored to an individual, but it's not just internal work. And that's why I always tell people, like, if the internal thing gives you the ick or you don't feel comfortable, you can still get the benefit of having treatment, but from a therapist who has the lens of pelvic health specifically. Even if you don't want to see or if you don't want to see like a regular physio, or you've been seeing a regular physio, but you have like pelvic health symptoms, you can see a pelvic health therapist without having an internal assessment or treatment necessarily, and still get the benefit of their knowledge. Right? And then sometimes we do exercises as well. So we go over what I want people to work on at home. Sometimes it includes pelvic floor exercises. Sometimes it's full body exercises. Sometimes it's stretching. Sometimes it's strengthening. So again, it just really depends. But I think with the conversations about pelvic health, people think it's like only internal all the time. And that's just not the case. There's so much variety of ways that we can treat pelvic floor things that normally your treatment session involves a little bit of everything.
Yeah, that's good to know, because some people might not go to a pelvic floor specialist if they think everything's going to be internal. So that's good to hear. For someone who's maybe nervous to seek help, whether it's shame or this is their kind of first step, what would you want them to know?
I think the first thing which people will always say to me is, that's not as bad as I thought. People say that to me every time. So I think people look at pelvic physio, particularly women, look at it through the lens of like having a pap test or going to a gynecologist. And my bestie is an OB, love her, but I know people don't love going to their gynecologist, right? It can be awkward. It's a little bit, can be a sterile environment. And so what I want people to know is pelvic physio is not like that. I try to keep my office very nurturing. It's very soft, light. Nothing is mandatory. I think that's the biggest thing. You don't have to have an internal exam. You don't have to tell me things you don't want to tell me on the first day. I am there to help you. You're not there to do what I think you should do.
Yeah.
I'm there to find the middle ground of what you feel comfortable with and how I can help you. And so everyone always tells me who is nervous, it wasn't as bad as they thought. So in the whole hour appointment, the first time you come to see me, we probably spend half of it talking. And then we take a look at your movement, like externally, back, hips, abdomen. And then the pelvic floor assessment, if you feel comfortable doing it, is maybe 5 minutes. So in the whole grand scheme of your first appointment, it's a very small amount of time that we're actually looking at the pelvis internally, because we're looking at is you as a whole person, and we're looking at the whole picture.
Yeah.
And I always preface my chatting portion of the conversation by saying you don't have to tell me anything that you don't feel comfortable sharing. And so I think what I just want people to know is that you're in control. Like, it's not me. You don't have to do what I'm saying just because I'm the therapist, or because I'm asking questions you don't have to answer. And I think that makes people feel like, okay, if I'm the one that's in control, I feel more comfortable seeking care.
Yeah. It's like interesting and funny to me how similar it is for our professions, because same, you're coming into therapy, people think, oh, you're going to tell me to like do all these things, or, you know, you give me advice that I don't want to hear. And that's not it at all. It's exactly what you said. You're in control. I might ask you certain questions, but you're never forced to answer any of them. And that's completely fine. And we're going to kind of move on, even if you're like, I don't want to answer that, Yvonne. Then cool, we'll go and do something else.
I don't know if you know Peloton or do Peloton, but we have a Peloton at home, and one of the instructors that I like, Dennis, his thing is, I make suggestions, you make decisions. And I think that is so true, particularly for allied health. I know sometimes it doesn't always feel that way with physicians and things like that, but that is how I try to operate my practice, is I make suggestions, you make decisions. It's ultimately not up to me just because I'm recommending something or asking a question, exactly like you said, right?
Yeah, I love that. And it does kind of allow the client to feel more comfortable and not as like, it makes it collaborative instead of, oh, this person's just going to tell me what to do. So yeah, that's really important. What do you wish more therapists like me maybe understood about pelvic health?
I think that maybe like when to refer to pelvic physio, because I think sometimes if someone has experienced sexual trauma, for example, they probably should see a pelvic physio, but then also kind of like making that clinical determination of whether or not someone is ready. Because just telling someone to go to physio, they might not be in a space where they are actually able to get the benefit from physio, right? They might have more trauma work to do. But yeah, I think just in general of like what physio does and when to refer at an appropriate time so that someone is getting the benefit. And I think it's probably the same vice versa for me, right? Like I could tell someone like, oh, I think you need to go to social work and discuss this, or you need to go to therapy and discuss this. But if they're not ready, sometimes you have to be able to make that clinical determination, because if you're giving them a recommendation and they're not ready to hear it, it falls by the wayside. And then they don't go. So yeah, I think that would be my answer, but I'm sure that you would probably say the same thing to me.
Yeah, same, exactly. Same. And also I think this episode is so helpful for me, and I'm learning a lot, because again, pelvic health has always been recently something that's been coming up, but it's not fully understood what happens in a pelvic health appointment. And so with somebody who is or has experienced a sexual trauma, they're disconnected from that, or really not wanting to even come close to anyone, you know, touching them, or there's a lot of that. But exactly as you kind of pointed out, it's not all internal. It's not all happening right, you know, at the very first session. You are working at building the rapport through questions, through understanding one another, all of those things, and always assessing the client's comfort, which is the biggest thing that, again, some clients maybe aren't aware of their rights in a session, right?
Yeah, I think some people really, like a lot of times in my experience, someone who's had sexual trauma has had a negative interaction in the medical system where they felt violated because of their trauma, particularly women. And so I think that sometimes makes people nervous because they feel that their autonomy and that their boundaries are not going to be respected.
Yeah.
And which is fair. If that's your only experience that you have to draw on, obviously you're going to feel that way and be protective. And so I just always think it's really important for people to know, and I don't say this to like rag on physicians or rag on the public healthcare system, because there's a lot of, great doctors, there's a lot of great benefits to the way our healthcare system is set up, but one of the disadvantages is time. And in a public healthcare system, there's not necessarily the time with your family doctor, the time with your physician, and you don't get to make the choice about who you see. Yeah. If you're seeking pelvic physio or therapy, you have time. Like people are with me for the first appointment for an hour. That's you never spend an hour with your doctor, and probably same for you. Yeah. Right? Yeah. And also you can make the choice about who you're seeing. So look up different physios. And nowadays so many people have social media. Look at their social media page. See if their personality or their values align, and you can have more control in the situation than I think people think, because of their experiences in public healthcare.
Yeah, 100%. And it is, again, those experiences that they've had are completely valid. Totally. And the, expectation that they may have for other professions, again, completely valid based on that experience. But it's, opportunities like this one where we're able to kind of educate everyone in terms of how that actually looks like, what an appointment looks like, what actually happens in an appointment. And it's not always something that somebody will share just like in a quick referral. Exactly. So I'm really happy to have you here and to kind of share this information, because it's going to be really beneficial for a lot of people. Okay, you kind of debunked this myth earlier, but is there another myth about pelvic floor that you would love to debunk right now?
I think, the two that we maybe touched on in the intro. So number one, if you've had a C-section, you still need pelvic physio. Yes. I think a lot of people who have C-sections are like, I feel fine and whatever, and then they have problems come up later down the line. Number two, it's not just about Kegels. There's a lot that goes into the pelvic floor function. So your pelvic floor has to be able to contract, it has to be able to relax. It does a lot of different things rather than just move up and down. And then that your pelvic floor has to be flexible and strong. I think those are the three that we've kind of sprinkled throughout. But just to reiterate, those would be my big three.
Yeah. And if there's one thing that you want listeners to remember from our conversation today, what would it be?
That you have a pelvic floor. And so that means that there's potential for you at some point in your life to need care for your pelvic floor, and your pelvic floor does a lot for you. It deserves a little bit of love in return. Yeah. So if you feel like you have even the remotest of symptoms, it's never a bad thing to get your pelvic floor and your pelvic health checked.
Yeah, thank you so much. Where can people find you?
So I am at Encompass Health and Wellness in Kitchener. So I see people in person, and if you are an Ontario resident, I can also treat people virtually. And then I have a podcast as well with my friend Nadia. It is the Birthwell podcast. So mostly focused on pre and postnatal and pre and postnatal and preconception health. So you can check that out there. I don't have any groups or workshops at the moment, but if you follow the Encompass page or my page, we will be doing workshops at some point later this year, just as a little plug. So keep your eyes peeled.
Yeah, we'll have all of Laura's links and information to her socials, podcast, and website on our show notes. But if today's conversation resonated with you, please know that your body's not working against you. It can work with you. It's just maybe about asking for a little bit of support from pelvic floor specialists like Laura here. Laura, thank you so much for being here. This was so informative. I learned so much.
It was so much fun.
It was so fun.
I love sharing knowledge and normalizing conversations about pelvic health. So thank you for providing the space to do that.
Of course. Thank you so much. And everyone else, make sure you follow us on Outside the Therapy Room Pod on Instagram and TikTok. And we will see you next time. Bye.
Bye, everyone.
Thank you for listening to Outside the Therapy Room. This podcast is intended for educational and entertainment purposes only. If you reside in Ontario and are interested in working with one of our therapists, please visit our website in the show notes. If you reside outside of Ontario, a quick Google search or search through Psychology Today will help you find a therapist near you.